Made possible through support from PASCO, Personal Assistance Services of Colorado, the ARC of Aurora, CCDC, Colorado Cross Disability Coalition, and Developmental Pathways. A THINK+change training.
Hey there, this is Jeff.
And I'm Petrie. We are advocates with the ARC of Aurora, and we are here today to discuss a THINK+change training as it pertains to people with intellectual and developmental disabilities.
So, I'm going to take you to school today. We're going to talk about IEP eligibility and evaluations. Why don't you kick it off with eligibility?
Okay. So, as everyone knows who's had a first-time IEP, it can be incredibly intimidating, can't it?
Absolutely.
Yeah.
Oh, God.
For sure. So we just kind of want to walk you through some of the ins and outs of IEP and what it all means, so that maybe you have a little bit more understanding and ease with the whole process. So in terms of IEP eligibility, that is based on a series of evaluations. And Jeff is actually going to discuss the evaluations in a minute.
But real quick, IEP is an acronym, so
Thank you.
Why don't we discuss what that stands for?
Thank you for the reminder. It stands for Individualized Educational Plan.
Okay.
Yes, so thank you for that. So what happens is you will go to a meeting to determine eligibility for an IEP. Does your child meet the standard or have the need for an IEP? You'll typically meet with a multidisciplinary team, and that team is made up of teachers, administrators, parents, the student, him or herself even, and anybody else who's familiar with the evaluation process that could be there to kind of lend some insight. So in order to determine if a student is eligible for special education, you create kind of a profile of the student. And within that profile, you're looking at academics, you're looking at behavior, and you're also looking at their current level of performance in terms of schoolwork. You also want to look at characteristics as you're going through the determination of things that perhaps support and maybe even dispute the disability as it impacts the student in the classroom. And then you also want to see, and this is a really important piece, does the student's disability adversely impact their ability to access education?
Absolutely.
Yeah. So once you've kind of taken all of that in, so it's a kind of a complete circle or view of the student, where their challenges are, where their strengths are. Once you have that complete kind of global view of the student, that's when you're then able to make the determination. And with that, you're considering all the evaluations that have taken place.
And those evaluations, we're talking about every aspect of the student, even areas where you think they might not have a challenge with. You want to get that evaluation because you never know what you're going to find out in that meeting.
That's absolutely
These
right.
evaluations can be OT, which is occupational therapy, PT, physical therapy. The speech and language pathologist is going to do some sort of speech evaluation.
Yep.
You're going to have cognitive evaluations. You're going to have behavior, social, emotional assessments as well. All these evaluations, though, when you sit at the table to discuss, you need the person that gave that evaluation at that table, because if there's any questions,
right, if you have
they
questions,
need to be there to answer.
Yeah.
So if you're having an evaluation about speech and the speech and language pathologist is not at that meeting, you need to stop and reschedule the meeting and have that person there.
Absolutely. Because all of these people are collecting data kind of based on their own testing, their own observations. And if they're not there to speak to what they've observed, what their data is actually showing, then you're not getting the full picture of what the student needs.
Right. And for instance, so if we're going over the evaluations and we're talking about the PT section and the gym teachers there, can that make up for PT's expertise?
Not really, no.
So in that situation, you would probably want to
again stop
the meeting.
Yeah, for sure.
Reschedule, and that is your right as a parent. If the right people aren't there, don't feel pressure like, oh, we don't want to inconvenience the school, because this all comes down to the child.
It does,
and we don't want to interrupt what the child needs.
Right.
to make it convenient for everybody.
That's right. And this is, like we said, it's an entire team helping to make this decision. And if the entire team isn't present, then you're not able to make the best determinations for the child. And that brings a good point to the way that you discuss all the evaluations. You want to make sure that there are multiple sources of data that are coming in to help this determination.
Absolutely. One area that's particularly challenging I want to speak about, and feel free to chip away if you need to. This is the great topic, the great debate of medical versus educational evaluation.
Yeah.
Okay, so first of all, what do you do when you get a medical evaluation? Well, if you have a meeting coming up, a determination meeting, the first thing I want you to do is get that medical evaluation in enough time for the teachers to look it over. Not just the night before.
Right.
They're not going to read it, or they might read it, but you need a little time to process. And you also, it's only fair to give people time to read and process.
Absolutely.
You don't want to force feed anybody. This is once again your child's overall well-being we're talking about. So get those medical evaluations in to not just one person, but offer them to everybody on the team. Because different people look at these evaluations in different ways, and there's a lot of different things we can find out when everybody gets the evaluations early.
And let's just give them an example. So let's just say it's a medical diagnosis of autism.
Okay, well, I was going to get there, but let's just get there now. So autism is often the biggest controversy with these medical versus educational evaluations. So a doctor might very well give you a test or assessment, give your child an assessment, and it comes out, yes, your child has autism. You take this assessment, you get to the school, and you expect autism to be part of the IEP.
Right.
Unfortunately, that's not the case. So what happens is a medical professional can see autism, but in the school environment, if the school isn't seeing autism as affecting that child, once again, in the school setting, then autism might be off the table as a disability category. Right. Now, that does not mean the school doesn't believe your child has autism. They're just saying that, yes, they have autism, but it's not affecting them in an educational setting.
It's not impacting them to access their education, in other words.
Absolutely. And one other thing to consider with these medical evaluations, one of the most common scenarios I've come across in meetings is we get a great medical evaluation, and then the school says, well, we appreciate you giving us this evaluation, but it was in a clinical setting, and in our school, it's an educational setting. So we appreciate the recommendations, but that's coming from a medical or clinical setting. So we're not going to necessarily honor these recommendations.
And it doesn't necessarily mean that your child won't receive an IEP. It just may mean that autism might not be a part of it.
But what I would encourage you to do to beef up the support of that medical evaluation, let's plan this IEP determination meeting around possibly the medical provider's schedule so that maybe they can't come in, that's rare, but we can find a time when they have a half hour to talk on the phone.
Yeah.
And, if they're on the phone for a half hour, let's make sure we address that evaluation while they're on the phone. Absolutely. You have the right to invite your doctor or physician or, nurse, or whoever might have some input from the medical clinical setting. It really helps to have them part of the meeting to back up that support in that argument. Oh, that's just a clinical setting and, this and that. Well, the clinical setting plus the actual clinical expert or professional to support their findings or their recommendations can push that a little further.
Yeah. Just as we referenced earlier, other individuals who are familiar with the evaluation process. And that's a perfect example of that kind of person who can still be part of the team and contribute to the eligibility and the evaluations.
Awesome.
Yeah. So 2 more things really quickly that I want to throw in there about the IEP.
Great.
One, it is a contract. It is a federal document. So that means if you move from the city of Denver to the city of Colorado Springs, that document follows your child from the Denver school system to the Colorado Springs school system. If you move from Colorado to Vermont to California, that document continues to follow your child and needs to be implemented within the school setting wherever your child ends up. So just keep that in mind, that it is a federal document, and it's important for people to know that it will follow the child wherever they go. The other piece of it too, and I think a lot of parents have some confusion around this, so I want to touch on this just a little bit. The IEP is implemented whether the parents sign off on it or not.
Wait a minute, really?
Yes. Now, if the parent doesn't agree with it, there are ways to dispute that. We discussed that in another series, so look for that if you do have some questions around that. While the parents are an integral part of the IEP team and input, the IEP, once it is closed, is still implemented for your child whether you sign off on it or not as a parent. So I just want parents to be aware of that too. Sometimes they think if they don't sign off on it, then it won't be implemented, and that in fact is not the case.
Jeez. Wow.
So do you have anything else in terms of evaluations, IEPs, any last bit of information to impart?
I think we covered it.
Okay. All right. Well, thank you guys so much for joining us today and learning a little bit more about IEPs. We hope this was helpful. If you have further questions about the process, you can always reach out to your ARC advocate. Stay tuned for more Think Change trainings. They'll be coming down the pike.
All right.
And
Pike?
Yeah, they'll be
You mean
coming
pipe?
that too. And we will see you soon. Thanks so much.